So I'm Dr. Heileson. I've been working for Shelby County Health System for about 20 years now. I didn't originally come from Iowa, though. I grew up in Los Angeles and Las Vegas, Nevada, with my family moving to Brandon, South Dakota when I was a freshman in high school. It didn't take me long after moving to South Dakota to realize that city life was not going to be for me. I ended up going to the University of South Dakota rural healthcare track and to get my medical degree. From there, I joined Clarkson Family Medicine in Omaha for my residency. After my internship year, I started moonlighting in various emergency rooms, and that's how I discovered Harlan. I very much enjoyed the community, and they seemed to like me, and soon we moved our growing family to Shelby County. Outside of work, I very much enjoy the outdoors. My wife, Tammy, she's been with me for 27 years, and we've raised our family on our 4 children on a hobby farm just west of Harlan. It started with an orchard and a small garden, and has grown to include chickens and turkeys and a pig named Penelope, some goats and a few Dexter cows, and I really enjoy that rural lifestyle. I've been able to get a rough farm and been able to plant some CRP and convert that into native grasses and prairie flowers. And I really enjoy going out there and planting more trees and shrubs and food plots for the deer and the turkeys and the pheasants. That's kind of how I recharge my batteries. I'd grab my fishing pole or my bow and arrow and my bird dog and head out for a little rest and recreation. I've been very active in our church youth group and in scouting. I enjoy working with younger people quite a bit, and I'd say my wife and I enjoy traveling to our national parks as a family and doing some international travel as well. I'm told what I do is becoming less and less common in the era of specialized medicine. I try to provide the traditional family doctor environment. I do clinic medicine, so well child checks to management of chronic health conditions. I provide inpatient care and services to my patients when they require hospitalization. I really enjoy obstetrics and took extra training to be able to perform my own cesarean sections and provide some higher risk obstetrical services when needed, and try to keep patients in our community. I also rotate regularly through the emergency room. One of the things I enjoy a lot about family medicine is just that, it's family medicine. I've cared for the parents, the grandparents, and sometimes the great-grandparents of that newborn in the nursery. I've cried with families at the death of their loved ones and celebrated with families at the birth of their newborns, sometimes on the same day. And I think it gives me a valuable perspective into the lives, needs, and care of those family members. And my life is richer for that. Thank you to those of you who over the years have trusted me to provide your medical care. In the era of Dr. Google, I think the patient-provider relationship is more of a partnership than ever before. Though it's impossible for me to be perfect as a physician, I'm always striving to keep up with the latest medical advances, guide and evidence-based medical recommendations, and provide the best possible health care to those who choose to call me their family doctor. I'm not in Shelby County because I have to be. I live here because this is where I want to be.